Hi, let me give you an idea how River Health works for the user. I'm logging on as Stig, he's the ambulance driver, because that's one of a few places where the patient can touch the system the first time or the second time or whatever. So Stig is out and he's stopping roadside picking up somebody, so he's going to register a patient. Admit a patient now, yes. This is a step-by-step and it's made for mobile devices, so it will look more or less the same as this on a tablet, for example. So let's see if we can find somebody called Peter or Pete or whatever. And yes, there is one, not many in this system just now. Let's proceed. And he has to choose what hospital is going to bring him to. And is this an existing problem? It's not. This one is the right arm. And so we're going to add a new problem for this situation. It just happened. Question specific clinical pathway. We just built in one here, hip fracture. If I chose that, then automatically a message will go to the surgeon in charge for today. And he can prepare the theatre, set up his team and so forth, even while Peter or whoever it was is in the ambulance. But I'm not going to choose that now. We're just doing the normal. Because I chose the big hospital, they know which one has duty now, so I'm going to choose Sylvie. So that means that Sylvie is now going to be responsible for me. I'm going to log out and put on Sylvie's hat. And Sylvie has a message here, incoming patient. So when Peter arrives through the door, she can click on that one and start working on him, which means a physical examination or whatever. This is the triage part. Here we got the medical record also. If I click on that, it opens. And here we see how the medical record displays in this system. It has an object which is the patient, and it has problems, like looking at the last one earlier, with all the details, physical examination, etc., and images, etc. Problems has a test scan, there will be medication, there will be anything related to the problem itself. I can also use filtering to find out more. Let's select the speciality we would need in this case. And let's say just urgent, complete. And then it gives me a list of diagnosticians. And I'm going to put Peter in bed 111. And off it goes. Now, one thing here, we don't push stuff. We let people pull, which is a smarter way of queuing and also the way the world works these days. So I'm still the owner, Sylvie is still the owner, but I do have Peter here awaiting handover. Until somebody picks him up, I'm responsible. So I can add more requests, more people to the request list. I can change case urgency, etc. from this place. And I will keep an eye on that, so I don't go off duty and somebody's hanging and waiting for something. I'm going to log out, log on again as Jack. And he has a request. Could have more, of course. He's looking at it, and you can see more about the patient, general history, and whatever, where he is, and so forth. And he's going to take over the case. And here we go. I got all the details I need in order to do the task I'm supposed to do, in this case, diagnosis. I can add the notes here directly, which then of course automatically becomes a part of the EMR, EHR, which is created in the background at all times and which is present here. This one is just a placeholder for a diagnosis library. It would be a different interface there, but it's embedded in this one. Here's another interesting part. Let's say that Jack is suspecting something because he has these fractures all the time here. So I can here add or revive another case for this patient. And I'm going to do that just to give you an idea of the flexibility here. And we see two problems. Select an existing problem or add a new one. I will add a new problem here. I call it nope. I'm going to step 1. Going to do that. I'm going to hand it to somebody else because this is a totally different one. Low urgency. And we got, let's see, Sylvie is the expert on that, so I'm going to give it to her. Now I get this question, is this problem related to any of the other problems? Of course it is. That's why I started off here. Yes, the new problem is due to? Nope. This problem is the source for another or other existing problems. So I'm going to set up a relationship here. And I'll relate it to both of these. So here we go. Now already now I handed this off, so it's a request for Sylvie. And I can look at that here. It's now a request. I'm still the owner of it, but the moment Sylvie picks it up, it's out of my hand. So I'm still working on the other diagnosis of Peter Smith. Let's look at the medical record now. Here we see the patient has problem, the new problem, which is just added. Actually, more than that, I can then open it and actually see the two other ones which are related, has a resulting problem as well, with all the details, etc., 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 etc. there. So I get very easy access and easy to navigate and very logical. It's not a hierarchy, it's about relations between objects and cases. And of course, on the bottom of the diagnosis part here, Jack can request tests, scans, hand off to surgery, hand off to nurse care, discharge, do whatever. If he discharges, it goes then and is decided if he shall come back to take off a plaster, for example, time is set up, or if it's a chronic disease, then he has to be handed back to a private practitioner that will keep him in the observation list, and so forth and so forth. And for every step, proper handovers happens all the time. It's unbreakable chain of events, and all the records are automatically created or captured by themselves, and everything is related to everything else, so it's easy to find later. All right, thank you. Bye.